Hello, I'm here to talk about oral cancer awareness. It's from a personal perspective of mine since I am a oral cancer survivor. Back in November of 2013, I was shaving and found a lump in the right side of my neck. I had it checked out by my primary care physician and she sent me for an ultrasound. Ultrasound found two masses in my right throat area. From there, I went for a biopsy in December. Biopsy showed cancer cells. In January 29, 2013, at Regional Hospital, my ear, nose, and throat doctor, Dr. Mark Fertali from Delta Medics, performed a surgery on my neck. He removed a mass, 6 to 7 millimeters. It was stage 4 squamous cell carcinoma. It was the shape of a figure 8. After that, 2 weeks later, went back to regional and had surgery done again by Dr. Mark Fertali, ENT from Delta Medics. He performed another surgery on my neck, and this time he removed my tonsils and 52 lymph nodes. I was in the hospital for 4 days. Upon my release, March 13, 2013, I was started 30 straight radiation treatments at the Delta Medic Cancer Center on the Morgan Highway in Scranton, Pennsylvania. Halfway through the 30 treatments, I ended up in Moses Taylor Hospital in Scranton in a badly dehydrated state. I was 2 days from renal failure and 2 days from AFib. I had bad thrush in my throat and my tongue. I could not swallow, could not eat, could not drink. I became my own advocate and advocated for a food tube to be placed in. I went to Dr. Michael Sundy at Delta Medics, and Dr. Sundy put the food tube in while I was in the Moses Taylor for 3 days. After that, I continued with radiation treatments with the food tube. It was hard trying to feed myself through the food tube with the Ensure. But finally, I made it through the 30 treatments, and I had 2 PET scans. I had a PET scan before the surgeries, and I had a PET scan after the surgeries. The PET scan before the surgeries showed cancer at the right top of the right tonsil. But when the tonsils and lymph nodes were removed, tonsils were clean, and all of the lymph nodes were clean except for 2 of them. 2 were positive for cancer. I had a PET scan done after the surgeries, after the chemo, or after the radiation treatments, I should say, not chemo. I didn't have chemo treatments, thank God. The PET scan after the radiation treatments showed that I was cancer-free. I continue at checkups with Dr. Mark Fertali, my ENT surgeon at Delta Medics, and I am living proof that I'm here today, thank God, to my primary care physician, Dr. Sheila Prahalad, and my other doctors, Dr. Mark Fertali, Dr. Rodney Wagner at Delta Medics Cancer Center, and Dr. Michael Sundy, who was my surgeon who placed the food tube into me. Oral cancer is becoming very dominant in this area. I suggest that everyone please get checked for oral cancer. You can get them done by your dentist, primary care physician, an ENT, but it's becoming very dominant in this area. Tonsil, lip, jaw, tongue cancer, throat cancer. Causes of it is smoking, chewing, drinking, and HPV virus. Mine was caused by the HPV virus, which is an airborne virus that you can pick up in the air around in crowds, not even crowds, just in the air. It's becoming very dominant in our area. So I hope this message gets out to all of yous, and yous all think about it. And coming up in April, it's Oral Cancer Awareness Month, and I hope this proves to a lot of people that be aware of oral cancer. It can strike anybody. Look, it struck me 2013 like a ton of bricks. But I'm here, I'm a survivor, and I'm going to be around a long time. Thank you for listening to me, and if you need any advice or anybody to talk to, please feel free to contact me. And I hope everyone is listening. Thank you.